All right, let's get started. Hello, everybody. Hope everybody's doing well and was able to absorb all the stuff that we threw out at you yesterday. Want to get started first by opening up to any questions based on some of the stuff we went over yesterday and you haven't a chance to look at it. So let me open it up to questions first. Nothing, TJ, you're good?
Yeah, I'm good.
Okay. Rick, you said you're going to be chat only. Dave, anything?
I'm good. My only questions were about success rates, and you guys talked about 1.5 apps a day.
So we try to shoot outside of open enrollment. We try to shoot for everybody to have 1.5 apps per day. So having their 1.5 apps, they're hitting their 7 apps a week, and we're exceeding their 7 apps a week, and everybody's happy because they're making money at that. That's kind of the goal we try to shoot for. Now, we'll have agents that will have 3 or 4 sales in one day, and then blank the next day, and then because they set stuff up, which actually is important to talk about. There's a bunch of times where some agents just really believe in filling the pipeline, and they're not closing people as quickly as others are. So because of it, they have filled the pipeline of setting it up where we're going to do your enrollment at 9 a.m. tomorrow morning. Now, I'm not going to say that that's a bad method. It's not the method that I would personally choose. In the same token, I'm not going to question successful people either. But on average, you should look at 1.5 a day outside of open enrollment. During open enrollment, it should be, at least 2 applications a day. That's definitely the route to go. From October 1st to October 14th, you should be setting up a lot of people so that come October 15th, you're doing nothing but enrollments. That first week should be the biggest week of AEP for everybody. The first and last week usually are. So that was a long answer to a short question. Any, do you want me to expand on that a little bit more, Dave?
No, that answers my question. The only other part of that is that's calling how many hours a day?
That would be a person who's working 8 hours, but when I say working 8 hours, they're not on the phone 8 hours, because let's face it, nobody is just calling for 8 hours straight. Between all the breaks that they're taking and the stopping to coordinate administratively, sending over the application that they just did to Jeanette. I would say from a phone call perspective, the most successful people are making 100 phone calls or more a day. When you first start, you're going to average somewhere in the neighborhood of 50 or 60 phone calls before you make a sale. Within the first week, you're going to get it down to high 30s, low 40s, as far as, again, number of dials. And then as you get really good, we got a bunch of agents that average about 17 phone calls per sale. So that'll kind of give you a breakdown of, you get better real quick. Within a few weeks, you get better at it being a lot less phone calls for you to have a sale. But then we have very experienced people that they've written 14 or 15 applications for the week, and the following week, all of a sudden, they're just getting their butt handed to them. It's just, part of the numbers game.
Sure, makes sense. Thanks.
Okay. All right, guys, then let's jump into the inbound script. So you had this person where you set them up right here of, Medicare requires enrollments be completed on incoming calls only. I called you today. Again, don't say, would you mind calling me back? Say, I need you to give me a call back at this number. set it up if they're going to go to the bathroom or whatever it might be, and you're sitting there waiting. And Nick, you know, I always go to you at this part of it because you basically wrote this, telling people exactly what you're going to do before you do it. So I'm gonna turn it over to you as far as what the first thing is that you're saying, and explain to them what all of this means.
Okay, so first and foremost, good afternoon, everyone. So basically, this step here, I feel personally, is extremely important. There are a lot of phone calls that I'm listening to, whether it be an agent that first started out or one of our very successful agents. Last week was the last time that I actually heard a phone call of one of our very successful agents spending, I believe he spent over 5 minutes during an enrollment explaining what a late enrollment penalty is, because of course there was an objection because he skipped this step, explaining why there is a payment method because he skipped this step. So it took away time from the enrollment. It distracted the enrollment. In the process, the call dropped. He then called this person back, and now we're taking time that would have been avoided if we just didn't skip the introduction. Okay, so it's very important. It's extremely helpful. It's letting the beneficiary know what's going to happen during the enrollment, what role you're going to play, and also the role that they play in the enrollment. Okay, so I'll just read that. Now, Mrs. Jones, before I begin the enrollment, let me just explain how the enrollment process goes so you know what to expect. I'll start the recording by reintroducing myself. I'll let you know that the call is being monitored and recorded for quality assurance. I'll ask for your permission to continue. Once you give me permission to continue, I'll ask you to confirm if you place the call in. I'll ask if you're completing this application for yourself or for someone else. You'll answer accordingly, and then I'll be asking a series of questions. These questions will determine why you are eligible for these benefits at this time of year. Now, during AEP, that part is going to be skipped because you no longer, at that time, of course, need to find an SEP, okay, or special election period. All right. Once we get to the question, do you have both Medicare and Medicaid, which is most likely the question that qualifies them outside of AEP, or whatever the question is that qualifies them, you'll answer yes, and this will enable me to move forward with the enrollment. I'm going to be reading through a bunch of disclosures, some of which does not pertain to you. However, these disclosures have to be read on every single recording that I do. There's going to be something in there about a late enrollment penalty. Now, this is for people who did not enroll in a prescription plan at the time of enrolling in their Medicare Parts A and B. However, you've had your WellCare prescription plan for some time now, okay? At that point, people that have a late enrollment penalty will know exactly what that is, and they will say something at that point in time. However, most likely if they don't know what it is, they probably don't have a late enrollment penalty, okay? I'm also going to talk about a premium and ways to pay it. This is not applicable to you because this plan does not have a premium. Now, if the plan does have a premium, guys, say you're doing an LIS plan of some sort or a plan just with a premium, you're going to state, yes, this plan has a premium of $14.10. Okay. However, because you have a low income subsidy at a level 1 at 100%, that premium zeroes out for you. Okay. By default, the WellCare system will generate a coupon book for you that will say $0. So when we get to that part of the enrollment, please respond coupon book. Now, if there's something that I read that you quite don't understand, please feel free to stop me and we'll go over it. I'll conclude the recording with a confirmation number for you to write down and keep for your records, and you'll have your benefits by October 1st.
Any questions at all on the introduction? Pretty straightforward, but if you skip this step, you are going to have a very messy enrollment. If you do this and explain to them what you're going to do, you'll find the enrollment just runs smooth and it goes a lot faster and a lot easier. So at that point, you're going to go to, hello, my name is Anthony Rose with Diversified Health. I'm a licensed agent in the state of the applicant state, not the state you live in, and appointed by WellCare. This call is being monitored and recorded for quality assurance. May I have your permission to continue? Obviously, if they say no, you have to say, you know, I'm sorry, all calls must be recorded. They all say yes at that point. Now, yesterday I was telling you about there's a lot of parts that you are bouncing around on, a lot of parts that you're not necessarily using. So you got to kind of follow what's taking place here, and you'll see that this script is a lot shorter than what than what it appears to be. So since you've spoken to this person already, it's Mrs. Jones, you've been transferred to me, or Mrs. Jones, we are speaking in order to complete the enrollment portion of this call. I will be entering information for. It is very important that you say the full name and the type of network. So if it is an HMO D-SNP, you're going to say the WellCare Value HMO D-SNP with a premium of $0 through Diversified Health. At that point, do you wish to apply for this plan? They say yes, you continue. If they say no, then you're going all the way down to step number 37 because you're not enrolling. You are not required to provide health-related information unless this information is needed to determine your eligibility to enroll in this plan. If you choose not to provide the requested health information, you may not be able to enroll in the plan. Will you confirm that you placed this call to Diversified Health? Obviously, they're going to say yes, and you're going to continue to step 4. Diversified Health is a licensed and certified representative of WellCare and may be compensated when enrolling you into this plan. Now, in order to process your telephonic enrollment today, a licensed sales agent must not be present with you. Besides me, is another licensed sales agent physically with you or on the phone now. This is a CMS requirement. You have to make sure that they're not being coached by another agent in order to enroll in this plan or not enroll in this plan. Now remember, this is the enrollment script. Everything has to be read verbatim. Are you completing this application for yourself or on behalf of someone else? Now, rule of thumb here is you want to take this script and you want to print it out in color and just kind of keep it in front of you. All of the blue is what you read. All of the black is directing you where to go, and all the red is where you have to, you know, fill in their name or whatever it might be. If they are completing the application for themselves and we are during AEP, you're going to just skip right down to step number 11. If we are outside of AEP, you have to go to step number 9. If this is a power of attorney or authorized representative, you have to go to step number 7. Okay, so if it is a power of attorney, you have to say, are you authorized to act on behalf of? Let's go down as if we are outside of AEP. So we're going to go to step number 9. Here's where you explain how open enrollment works. Think about this as if you've put an application in front of somebody's face, and you are supposed to ask them every question, and they are supposed to read every question on the application. When we were doing the sales script, we explained that you don't have to go through every single one of these questions because you found out, for example, that they have Medicare. But when doing the application, you have to go through every question on it. Okay? Again, only if we are utilizing an SEP, not because we're outside of open enrollment. So typically, you may enroll in an MA plan only during the annual enrollment period from October 15th through December 7th of each year. There are exceptions that may allow you to enroll. I'll ask you some questions to see if we can establish an enrollment period. Please respond with yes or no if any apply to you. By stating yes to any of the following, you are certifying to the best of your knowledge you are eligible for the enrollment period, and if we later determine this information is incorrect, you may be disenrolled. You then have to ask every question here until you get to a yes. So ask them if they're new, ask them if, well, are you enrolled in an MA plan and want to make a change during OEP? Again, that's if we're doing this January through March. If they've moved, jail, if they've had a change in Medicaid. The question that normally you get a yes on is, do you have both Medicare and Medicaid? That's usually where we have our special election period. Again, remember, starting October 15th, we're going to be skipping this entire step until December 8th. Or I'm sorry, January 1st. Once you got a yes, let's say it was on the Medicaid question, you don't have to ask any of these other questions. It's once you establish the SEP, then you go to step 10. Based on our conversation and the eligibility plan identified, you are eligible for the, say the plan name, your proposed effective date is always the first of the following month. Please know that just because it is the last day of the month or 2 days before the last day of the month, and the person says, you know, I have a doctor's appointment next week already set up. Why don't we do this for the first of the following month? You can't do that. You have to wait until the first to do that because it's always going to be effective the following month unless they're aging in. That's a different story. But if they're not aging in, it has to be the first of the following month. So please state your full name as it appears on the red, white, and blue Medicare card. Please state your date of birth. Please state your sex. We realize that you've gotten a bunch of this information already, but this is the actual enrollment. You have to make sure you're going through all these questions. May I have your telephone number, alternate contact, email address, permanent home address, mailing address, emergency contact. That is, that's your basic information. Then you're going into, may I have your Medicare number? Follow the map. If this is an MA or an MAPD plan, state you need to be entitled to Medicare Part A and be enrolled in Medicare Part B to enroll in this plan. I have the Part A and Part B effective dates as they appear on your card. Now follow the map. If they have A and B and you are enrolling them in an HMO, PPO, or SNP plan, you're going to go to step 13. If they have a private fee-for-service, or if you're enrolling them in a private fee-for-service, you're going to go to step 14. I don't think we've enrolled anyone in a private fee-for-service in 3 years. So just to make you feel a little bit better there. If you were doing only a PDP enrollment, then you would actually skip this right here and just go to if PD plan, P plan state and follow it from there. So let's say we're doing a PPO plan, we're going to go to step number 13. Read the black to decide if you are supposed to be reading it or not. If you're enrolling them in a health plan with a 0 monthly premium, this is what you're going to read to them. If you're enrolling them in a plan with a monthly premium, this is what you're going to read to them. For all MA, MAPD plans with or without premiums, you're going to read all of this to them. Please select a premium payment option, Social Security deduction, rural retirement, or get a coupon book. If you did it the right way in the introduction, they're going to know right here to say coupon book. Okay? Knowing what their response is going to tell you what next section is that you read. If they had said Social Security deduction or rural retirement deduction, then you would be reading this. But you want them to go coupon book. So you do this. If get a coupon book, state. Now, you're going to go to step number 16 here because this was, if it was a private fee-for-service plan, we're not doing that. So we're going to go all the way. This is if it was just a PDP plan, not doing that. We're going to go all the way down to 16. Do you have ESRD? If they say yes, you have to find out if they had a successful transplant, so on and so forth. You then go to step 17. Some individuals may have other drug coverage, including private insurance, TRICARE, VA benefits. Will you have any other prescription drug coverage. Now, this is for those that have like a TRICARE, for argument's sake, or even an S COP, some sort of state pharmaceutical assistance. You are going to go and capture this information here. What is the name of the other coverage? What's the ID number? What's the group policy number? Do you live in a long-term care facility? If it's no, you're going to continue to step number 21. If it's a yes, you have to find out what the institution name is. Are you currently enrolled in state Medicaid? If no, go to 22. If yes, go down to 23. I'm sorry. You have to get the Medicaid number and then go down to number 22. Here's where you're asking the doctor information. Now, again, guys, if you've done it the right way, you've already set it up where you don't have to say, this PCP is not a part of the plan. Would you like me to help you select one? You've already done that. You've already set it up with them so that they're stating the name of the PCP. If they decide they don't want to give you a doctor's name right now, all you have to do is say the plan will select one for you, and you could change doctors at any time by calling the plan. If available, this is read to everyone. If available, would you like to receive your plan information in language other than English or an accessible format? You want to get it in large print. I would like to review the information we've just collected. Now, keep in mind, all the info that you've just received, you have input it into the computer as you were receiving it. All right. So now I want to review all the information, and you have to review everything that they just read. First name, middle name, last name, date of birth, phone number, sex, address, zip, PCP. Is this correct? You don't have to say, is this correct after every line. It's at the end, is this correct? If not, correct it. Then go to step 26. If you intentionally provide false information, you will be disenrolled. Do you certify this information provided in this application is accurate? Now, Nick, I want to just go over to you for 1 second. You mentioned to me once that, or I've heard you say in the past, where you had people just kind of give you the What do you do in that circumstance?
Okay, so during this enrollment, you have to get a clear yes or no answer, okay? So for instance, when you're going through those questions to find an SEP or for them to state their SEP, are you new to Medicare? I'm sorry, Mrs. Jones, but I'm going to repeat the question. I need you to answer yes or no. Are you new to Medicare? Another thing that I want to mention while I have you here, you do not want to coach them to or tell them what to say or answer to a question. Okay. You can't say, no, Mrs. Jones, say yes to that question. Or Mrs. Jones, I need you to say no to that question. That is unacceptable and it is not compliant. Okay. It is okay to say, for instance, do you have Medicaid through the state? Medicaid? And sometimes they're just all over the place. For instance, we call Medicaid in Maine, the state of Maine, Maine Care. So they don't identify it as Medicaid, okay? So it's okay for me to say, for instance, Mrs. Jones, that's your Maine Care. You know, the Medicaid through the state, I need you to give me that number. Oh, yes, I have Medicaid. And then they'll go to the number and recite the number. However, you cannot answer for them.
Perfect. Okay. Anything else up to this point that I missed, Nick?
It was one thing that I missed in the beginning. Make sure when you do that introduction, make sure they have their Medicare card out and their Medicaid card out. Okay, you don't want them saying, oh no, I'm not at home during an enrollment call. I'm not at home, I don't have it. Or my wallet is now in the car. And then you have to stop your enrollment and start it again and have them call back in when they retrieve that information. You just let them know, just prepare them as much as you can. during the enrollment, I'm going to need you to have out your Medicare card and your Medicaid card, whatever is applicable to them at that time, right? Just so they're prepared with that information.
Okay, great. Great. Okay, now we're at our disclaimers. And again, this is where the whole mapping process takes place. Now, we need to go through some important plan information. Tells you right here where to go. If it's an MAPD plan, go to step number 29. Let's go there. So we're going to skip all 28 because it says if private fee for service. This is all 28. Now we're at 29. If MAPD plan. If you currently have health coverage from an employer, joining welfare could affect you. You can use your employer union coverage. You have to read all of this. Keep going to 30. Now, if it is an MAPD plan, you are going to read this. If it is only an MA plan, which we don't really do much of, but if it is an MA only, you have to include this paragraph in this when you read it. All right? So again, remember, follow the block. Follow what it says as far as the italicized block. So you're agreeing to the following. This is the plan. It's your responsibility to inform them. It's not an MA only, so we're going to skip it. Enrollment in the plan is generally for the entire year. Once you enroll, you may leave this plan or make changes only at certain times. Just to move it along. Once you're a member, you have the right to appeal. You'll read the evidence of coverage. You're going to read all of this. Now, decide if this is a PPO or a non-PPO. If it's a non-PPO, you're going to read this. If it's a PPO, you're going to read. You understand that beginning on the date wellcare coverage begins, using service in-network to cost you less than using services out-of-network, except for emergency or urgently needed services. If medically necessary, WellCare provides refunds for all covered benefits, even if you get services out of network. Continue reading for all MAPD plans. Services authorized by WellCare and other services containing your WellCare evidence of coverage. The document will be covered without authorization. You understand if you're getting assistance. WellCare complies with. Now you're going to go down to step 32. If in the beginning, I showed you where to skip the private fee for service part. If this was a PDP plan, you would have skipped even step 30 and gone right to if PDP plan. Because this isn't a PDP plan, you're going to skip this. Skip all of this. This is all part of PDP. And you are going to be down at step number 32. You understand that your verbal signature or verbal signature of the person authorized to act on your behalf on this application means you understand consent of this application. Please state, I agree. If they do or they say yes, or they say okay, you cannot continue. You have to get an I agree. This is their signature. The application cannot continue unless you state that you agree. Do you agree with the statements that I have just read to you? If so, please state, I agree. You have to get that. Now, if you are dealing with a POA here, then you're going to go to step number 33. If you're dealing with the person who's actually enrolling, then you're going to skip 33 and go to step number 34. You complete an application for such and such for WellCare. You give the date. This completes the Medicare Advantage prescription drug portion of your enrollment. Now I'm going to give you the WellCare confirmation code and ask that you write it down. Please let me know when you are ready. So when you submit this application at this point, you're going to get on your screen a confirmation number. That confirmation number is huge. That is the finish of the sale. If for some reason you were unable to give them that confirmation number on this call, it's not a sale. You have to make sure that you give them the confirmation number. Give it to them. Your application is being submitted to WellCare, who will submit it to Medicare for approval. If your enrollment application is approved by CMS, the plan will mail you a new insurance card and your evidence of coverage within 10 calendar days, or the last day of the month prior to the effective date of the enrollment, whichever is later. Should they require additional information to complete your application, you'll be contacted by phone or mail. If it is determined you are not eligible, a letter will be mailed to you within 10 days. If you have any questions about the plan's benefit, feel free to call such and such. This completes your application. this is when you go into, whether it's referrals, whether it's here's my information, feel free to call me at any point. It's been a pleasure. All that other sugar on top stuff before you end the call. These other steps here were at the beginning of the script, where it said continue down to 37, where basically you got denied. That's where this stuff is. And we know everybody on this call is good enough that they're never going to get to the point of being denied. And that's the enrollment script. That's the enrollment process. Like I said yesterday, you'll get better at it, and it's not as, it seems very tedious right now, but you get the flow of it. As you do it, you get to see that it's not so bad. And you'll finish these things in 20 minutes or so. That is the inbound script. So I want to stop and I want to open it up for questions. I want Dan, Nicole, Akram, Jeff, any input that you guys have that might have been missed. So let's roll. Go.
Really quickly, guys, I just want to add, with this script, as you see at the top here, it has to be on an inbound call. The enrollment has to be the beneficiary calling you back to complete the enrollment, right? I was telling you guys earlier about one of our agents that, he spent about 5 minutes explaining what a late enrollment penalty because he skipped the introduction. Okay, move past that. After doing all of that and getting back into his enrollment, unfortunately, the call dropped. Okay, he proceeded, and then, it happens. We're human. He just proceeded to call the person back, and he started continuing the enrollment. And I just happened to go back in and look at the call, and I'm seeing pound, which I know when I see a pound before the number, that means our agent called the person. But he proceeded to do the enrollment on an outbound call. And I had to stop the enrollment and say, look, you have to have this person give you a call back to continue the enrollment. Now, he was frustrated, but he was compliant. Okay, so just remember that this enrollment has to be done on an inbound call. I'm sorry. So they have to call you back to complete the enrollment.
And with that said, you don't have to, if you were to get disconnected halfway through and they call you back, it's okay that you're picking up where you left off. You don't have to go back to the very beginning you started. We just have to know that there's this amount of recordings that we have to pull, because we're going to have to pull every recording of how to do it. It's okay if it took multiple phone calls. We had an enrollment once. The lady just kept getting disconnected. She kept calling back. And it was like, do you remember this, Nick? We were laughing about this. It was Heidi. And the lady just kept calling back. I'm so sorry. Please continue. Yes. And then she got cut off again. And it almost became a joke. Is she going to call back again? And she did. But that's okay. We were able to piece those together. But it has to be on email.
Right.
Anything else, Nick, that you wanted to?
Oh, really quickly, because I think I forgot this yesterday. Getting someone to call back, you're not asking, you're being courteous, of course. You're showing the utmost respect. However, it's the process, okay? And remember, you're in charge. So you're telling them what the process is. And quite naturally, as the leader, they're going to follow you, right? So you're not saying, do you mind giving me a call back in the next 2 minutes? They're going to think it's not urgent, okay? This is urgent. It needs to be done now. Medicare requires that all enrollments be done on an inbound call. I need you to give me a call back. I'm going to set everything up here. Between that time, you just give me a call back. I'll take your enrollment on the recorded line, and you'll have your benefits by October 1st. And you'll find that people will call back right away because you put the urgency on it. So just remember that. You're not asking permission to do your job. Take control and let them know what the process is and have them follow the process.
Good stuff, Nick. Good stuff. Okay. Any questions at all on the script?
Hey everybody, Dan here. Sorry I missed you guys yesterday. I'm glad to be back today and kind of walk through some of my ins and outs here. I see that Rick added a couple things. Most of what I'm going to offer you over the next 5 or 10 minutes is going to be mostly operational type stuff. And since Rick went to the local area codes, let's just jump right on that. As you guys probably learned yesterday when Anthony was going through everything, and Mike, there's a technology perspective that comes through with this. Obviously, you need your laptop or some sort of computer. And the other one being, as of right now, as it currently stands, is one of our Yeelink phones. And those will be discussed over the next couple of days after training is complete, how we get one of those in your home. When we have one of those phones in your house, what you're able to do is, actually, if it's okay, can I take over the...
Yeah, Dan, I just want to stop you for 1 second. You start speaking at the same time that Akram was. I think Akram had a question.
Oh, I'm sorry about that.
About to state something.
Mr. Jacob, I apologize.
No, that's fine. Actually, it's not a question, Anthony. It's an answer for, I believe Dave yesterday was asking if do we have to mention to them over the phone that they will be automatically disenrolled from the prescription drug plan.
Right.
The answer for this is on the last part of paragraph number 29, where it said you can be in only one Medicare Advantage plan at a time, and you understand that your enrollment in this plan will automatically end your enrollment in another Medicare health plan or prescription drug plan.
Okay. So that answers that question. Okay, great. Great. I'm glad you brought that up because yesterday I said we'll get to that when we do the inbound script. Yep. Yep. Okay, awesome. Anything else, Akram?
No, I thought that would be
Yes, very much so.
It's part of the presentation, so you don't have to separately mention it on your.
Awesome, thanks. Dan, I am not sharing screen anymore, so I think.
No worries, I'm on it right now.
Okay, awesome.
Can you guys see that?
Yes.
Great. So, Rick, to kind of answer your question about the local area code for outbound calls, what we actually do is whenever you're making an outbound call, you guys can see on the right side, you can actually see our system right now. Anytime you make an outbound call, you see one of my mouses here, you're actually going to pound whatever region or area you're in. So we have about 40 some odd numbers here in different areas, and they'll be added as we add states over the next month. But we have a local number in all of them. And what we do is we just press, if we're calling a local area, before any phone number and the area code, we press pound, and then whatever that code is. So you can see it in use here. Ooh, wrong one. Just so you could see it in use here, you'll see right now Joe Naveau, an agent in Maine, is calling into Bangor. So he's in actually southern Maine. If you're familiar with Maine at all, he's in Portland area, and Bangor's kind of in the middle of the state. So he wants to trick the person. He doesn't want them to come up that it says he's calling from Portland. He wants to call right from Bangor. So he does pound 21 and then the area code 207-338-1213. Let's see if I can get that a little zoomed in more for you. Again, pound 207-338-1213. And we have them all across the area to make it look like it's tricked calling from a local area code. Here's another one right now. So Mike Fuji, he's calling in his house in New Jersey right now. Pound 34. He's calling Nashville, Tennessee. He's trying to trick the person to make him think that he's right there in their neighborhood. It works often. So that's how we kind of go through that the trick for the local area code. And if it's okay, I'm going to go right into the rest of the stuff that I usually share at this point.
Yeah.
All right, great. So this point of script, there's a few things. We went through how to get enrollment. We went through how to, do the sales process, how to get the enrollment. Next on the list here is basically how to look up doctors, making sure they're in the network. Where do we look up drugs, making sure that those are in the network. And then, most importantly, if anything else, what are we actually going to be presenting to the client? So I'm going to take you through all the 3 steps right now through the different websites that we use with the telesales process. First one's going to be, and I'll share my screen again so you can see it. First one's going to be right on wellcare.com. And you're on Wellcare. Sorry, can you guys see that screen?
Yes.
Okay, great. When you're on wellcare.com, just throw in your state. We're going to start with the doctor. So on the upper right corner, it's going to be find a provider or pharmacy. It's going to click that green tab. Okay, now, whenever I get a doctor from any client, whenever we hear them, before we do anything, the first thing I want to do is make sure this doctor actually exists at the address or town or area that this client says they did. You know, one thing with clients, they may not remember everything. They may not remember the doctor's name, address, phone number, town, but they'll remember a few of those things. So what I want to do is I'm going to use my example, my doctor as an example, Agresti and Nutley. And there he is, his address 181 Franklin Avenue, 07110. I just want to have that in front of me before I get into searching for them. Make sure that they exist. Make sure you know that they're real. A lot of times they may think the name is Jackson, but it turns out the last name is Johnson or whatever it may be. So we always want to find a doctor in that area first before we move on. So a few ways you can look it up. You can look up under whole address. You can look it up under town. You can look up under zip code. So in this case, we're going to go New Jersey. We are going to do the, let's call it the focus plan. It's just one of the plans in Jersey. Zip code 07110. As well, you could do a city, state, county, address, whatever you like, but we're going to go zip here. You can look it up by provider name or specialty, whether it be gastroenterologist or eye doctor, ear, nose, and throat, whatever it may be. You're just going to type it in there. In this specific case, we know the provider's name. It's Agresti. So I'm going to click Go to Results. And there he is. He pops up there. He's primary care provider, family practice, same address. And sometimes it may be a different address. Maybe he has multiple locations. So I always like to find the one with the provider ID that has the address of which I know the lady told me she was at, or the client, gentleman. All right, so you have the provider ID. I would keep that in all your notes, whatever you submit to us later on, and we'll get to that. After you're going through the entire sales call, you know what they have now. You know the who, what, when, where, and how. I would always put that provider ID just to prove that you looked up the ID at the time of the enrollment that the doctor was in the network. Who knows what can happen 6 months, a year, 2 years down the road. Maybe the doctor leaves the network for whatever reason, maybe whatever it could be, any reason. So we always like to encourage you to write down that provider ID as well. You'll need it when you get to the enrollment application. So that's the doctor portion of it. Pretty straightforward. Let's try a different one here. How about there you go, Dr. Agresti in Chester. That actually is a perfect example. They're saying they're Agresti in northern New Jersey. They can't remember. Well, he actually has a James Agresti, the same doctor. He has an office in Chester, which actually I didn't even know about. That's actually closer to Mass than the one I go to. But just an example there. Questions about the doctor? All right, cool. Let's move on to summary of benefits. How do we find what plan in what area? Okay, so again, we're just going to go to wellcare.com. And we're going to select our state. In this case, we'll use New Jersey again. There's a few things you can do. Every state is a little different. Some states have the green, I'm looking for a plan, need a plan right here. But it doesn't matter if you're in New Jersey or where, it always says need a plan right on this upper left corner below WellCare. So I'm going to encourage you guys to use that one. That'll take you to these blue boxes here. And what you're going to do is I am seeking a Medicare plan. Now you want to skip Medicaid or prescription drugs, so it's only going to retrieve those specific plans. So Medicare plan near whatever zip code you're looking to be in. So I'll give you my specific one, Morristown, New Jersey, 07960. And it'll give you all the plans in Morris County. In that specific county, there's 3 plans, the Compass, the Liberty, and the Value. So you just click on, you don't want to do the green compare plans and enroll. because that would take you to the Medicare.gov enrollment portion. You don't want that. You want to just look at a PDF of all the plan benefits. I want to learn more about this plan. And then right here in the middle of the page, you have summary of benefits in a few different languages. I'll take a quick second and download. And we're not sure how the 2021 enrollment guides are going to look, but right now for the 2020, they have multiple plans on each packet. So if you're looking through a plan, you may try to figure out which is the best one for you. You can compare like plans to each other. In some cases, you'll have two different D-SNP plans in the same county. Maybe it'll be a dual PPO, and maybe it'll be a dual HMO. So you'll be able to say, all right, you know what? This one's better for you, Mrs. Smith, because both your doctors are in this network. Or one doctor is and one doctor isn't. So you can compare, like, you can see them side by side as like plans. When you're going through your presentation, everything's pretty straightforward. It's all listed here for you. Monthly plan premium is $0. Deductible, there is none. Maximum out of pocket, $6,700. Inpatient hospital stay, $475 for the first 1 to 4 days, and after that, day 5 to 90, everything's covered. If you choose to go to a doctor that's out of network, there will be a 40% co-insurance, and you're literally reading right down the list all the way through to get to the really good stuff where it talks about the, and I'm going to go a little faster here. Too fast. You get to the good stuff where it starts telling you OTC, $50 every quarter. Drug benefits there. I was looking for dentist, but I think I missed it somewhere in here. But in any case, that's how you're going to pull them. Let's just recap that one more time. Right on the wellcare.com site. Last week we had somebody on the line from Florida. So just use Florida again. Click in the plan. State. Need a plan. I'm seeking a Medicare plan. Oh, actually, you can see here they have another option here. Again, just making sure we're just using Medicare. You choose 33477. Yeah, there it is. Oh, I accidentally clicked in Spanish. Plans pop up, and all the different options come up. In this case, let's use the Access SNP plan. I want to learn more. Summary of benefits, download. And then all the summary of benefits will come up. So you can join. Tells you everything you need to know about the who, what, when, where about the plan. Summary benefits. Questions so far about the doctors and how to grab the summary benefits? Awesome, awesome. I'm in the chat, nothing in the chat. Let's go to how you check the drugs. Now, when we get to the enrollment portion, there will be an application I'll use, and you can see on the screen, it's called Ascend. And Jeanette is on our line today. She'll walk you through exactly how we use the Ascend platform in a few moments. Eventually, Ascend is going to actually be a place for you to check the drugs right on the website. Right now, we don't actually recommend you check the drugs on the WellCare platform. We actually have an application that we found that's been awesome. It is a phone, iPad type or Android, platform application. It's not a website-based application, but I'm going to share the link right now in the chat, and then I will walk you guys through both of them. So if you're an Android user, that's going to be the one you want to use. And if you're an iPhone user, that one will be in the chat as well. We have the two links there. When you're using the platform, it's pretty straightforward. If you can see here, this is the one you're going to use for the Android, that same exact type setup. On the app, you literally just write whatever the drug is right here. Tell it what state you're in and that you want it from Medicare. And it's pretty straightforward. It actually tells you that it's right in the network. It's a preferred drug with WellCare. Green light means they accept it. It's pretty simple to use, and that's kind of the one that we always encourage you to to go with. Same thing for an Apple platform. iPad as well. Thoughts about doctors, drugs, summary benefits? All right. Jeanette, are you with us?
I am with you.
Excellent. We are on procedures here. Before we get to the procedures of how to submit it after the procedure, I'm going to ask you to take the screen over, and then you can kind of go through what the Ascend platform does and how it works.
Okay, sounds good.
Question. This is TJ.
Sure, TJ.
So at what point in the process am I looking up doctors' prescriptions and what was the third one that we just covered right there?
Yeah, no worries. And which plan to use. So
Yep.
I have to tell you, I can't give you an exact format because every agent is a little different. Okay, and the only reason I say every agent is a little different, some people can multitask and do the stuff on their phone. Some people just aren't given that same God-given gift where they could do a few things at once to check them out. What I will tell you about the plan lookup, where you're doing which plan to go to, Nicole will tell you, and it's kind of what everyone's kind of followed her on is, I'm sure you talked about SPOP yesterday. You never actually call SPOP. You never actually make a presentation until after you've gotten through SPOP, right? You don't know what plan you're going to go with. When you get on with SPOP, you're going to know what exactly to present. If the person's on Medicaid, Medicare, dual, LIS, whatever it may be, you'll know right on by that call what your solution is going to be for the client.
I also want to step back to the 10 steps, the 10 steps that we did yesterday too. If you go to the very first page of the outbound script, where we have the 10 commandments of Medicare Advantage telesales, we have it where you're doing your fact-finding questions, and then you're going into looking up right there, looking up the prescriptions and the doctors, and that kind of flows in that script. That's section E2 and E3. That's before you're going to tease them a little bit more, and then calling SPOP, which is totally consistent with what Dan just said. You're not calling SPOP until you know exactly where you're going with these people and what your situation is with them. So after you ask all those fact-finding questions, knowing their circumstances, knowing what's important to them, that's when you're going to go to start looking up the.
Okay. All right. Thanks, guys.
You got it.
And again, though, it's key. Some people are. There's a lot of good agents that are able to have the conversation and find out what the drugs are, and at the same time, they're already on the website looking up the doctors. But there's a lot of people who may not be as tech savvy that can't do that, and they literally have to get a list of 4 or 5 doctors and say, okay, Mrs. Smith, hang on one second. Let me go check all those doctors all at once. And you put them on hold or have some other side conversation about what happened on Monday Night Football or whatever it may be, just to kind of get through. But there's others who are able to be savvy enough and have the conversation at the same time.
Makes sense. Thanks.
You got it. All right, Jeanette, it's back to you.
All right. So this is a website that you would use to log into your Ascend portal. And the username is the email address that was provided to WellCare when you were
sorry,
onboarded.
I don't know that. Can anybody see? Because I actually can't see it. Is it just my screen?
I can't see anything either.
Huh.
Yeah, if you could. I took it back from you when I shared the presentation. So
Hold on.
it.
Hold on one second. Can you see it now?
Yes.
Yep.
Yes.
Okay. Okay, so this is the website that you would use to log into Ascend. Your username is the email address that was provided to WellCare when you were onboarded. The default password is WellCare123 with a capital W. Once you log in, you will be prompted to update your password after your initial login. Okay. The first thing they're going to ask you for is the zip code. So you will enter the zip code for the beneficiary and hit continue. If there are multiple counties with that same zip code, it will ask you for which county the member is in, and then you would click continue. Okay. After that, it will come to a blue button from Medicare. This is not available for telesales, excuse me. The blue button would take the client to medicare.gov, but since we are going to enroll the member now, you would click no, I prefer to enter the information manually. Or you can just skip it completely and click on number 5, which is our plans. Once you click our plans, it will bring you to the financial help screen, and you are able to check the eligibility of the member on this screen as well. If you do not want to check the eligibility, you can skip it and just click no. If you do check the eligibility, you're going to fill out the first name, the last name, date of birth, Medicare number, the Medicaid number, or the Social Security number. And then you would click check status. Okay. After you check the eligibility, it would, if there is any eligibility level, it would come up like this, and you would see the screen. If there is no extra help or anything, then it would come up like the right side of the screen. There will be no data provided if there's no eligibility status. And then you would click continue. And it will bring you to the plans that are available in the area. And with this option, you are, just make sure the zip code is correct. And you are able to apply now if you know which plan you are applying for, or you can hit view details. If you are looking to enroll in a prescription drug plan, you will have to click on the prescription drug plan tab. And then it will show which prescription drug plans are available in that area. If you do view details, this is the screen that comes up, and it does show you the summary of benefits. And you can also click apply now from there. If you want to return to the previous screen, you would just have to go back to quotes. Okay. And then it gives you, it brings you to the enrollment itself. You will fill out all the information of the beneficiary. On the bottom here, you are able to save the enrollment. There is also an option for send for signature, but telesales agents are not going to use this option. And you will click next. and it will bring you to the permanent address. If there is a mailing address that is different than the permanent home address, then you would have to check off this box. It'll bring up this portion to fill out the mailing address. Then you would click next. This is where it asks you for the emergency contact information. You would fill out the first name, last name, relationship, and phone number. Once you start typing in the field, all the fields are in one of the fields, all the fields are required, and then you would click next. If you do not have an emergency contact, you don't have to fill this out. You can just click next. And this is where it brings you to the provider. So with the provider, they are asking for the NPI number. You would be able to put that in. If you do look up the provider, you would just have to make sure that you add the provider and then save it on the bottom. They also ask you for if they're a current patient, and then you would click next. For the provider lookup, this is what it would look like. You would enter the doctor's name and make sure the zip code is correct and select the distance. You are also able to do an advanced search as well. This is what the advanced search looks like if you are going to do that. You do have to make sure that you pick the correct plan that you are searching for. And you also have to check the specialty, whatever specialty they are. And then you would click search. Then you would find which doctor you are looking for. And like I said, you would click this add button and then save and close this portion. Okay. And this is what it would come up. Well, it would look like once you click add. It does put in the NPI number for you, the doctor's first name and last name, and then you would click next. If you fill in the eligibility form, the Medicare number and the Part A and B effective dates will already be filled out for you. If you decide not to check the eligibility, then you would have to fill in the Medicare number and the Part A and B effective dates and click verify. Then you would click next. This is where it's asking you for the special election period. And right now there's the three options of I am newly eligible for Medicare, and this is my first entitlement to enrollment. I am newly eligible for Medicare Part D prescription drug coverage, or my situation falls under one of these special election period circumstances. Most likely you would be choosing the third one. And then you would click next.
As of right now, most likely it's the third one, but what we're assuming to happen based on past experiences with WellCare technology, there will probably be something on that same slide on October 15th that will unlock, and that'll be one of the four. It'll be four options on that day is our guess, and that one will be just, you know, AEP, and you move on to the next page.
This is where it will be asking if the member has ESRD, living in a long-term care facility, if they do have a Medicaid. If they do have Medicaid, you will have to fill in the Medicaid number here. It also gives the language preference, and if they want their materials in large print, and then you would click next. This is where all of the disclosures are that are on the enrollment. And you would also have the signature here. So you would be typing in the beneficiary's name here. If it is a power of attorney or an authorized rep that you are speaking to, you will be typing in that person's name here. Right here is where they're asking if it's done for themselves or if it is an authorized rep or power of attorney. And it will ask you for the power of attorney or authorized rep's information once you click that button. And then you would click next. And this is the part where they ask for the payment. Send me a bill and coupon book is always marked off unless they do choose the electronic funds transfer from the bank account each month or the deduct from the monthly benefits. Then you would click next. This is where you are able to review all of their information. They do have different sections where you can, if it is incorrect, you can edit it in just that section. You don't have to go through the whole application to edit.
Hang on one
that
second,
part.
Jeanette, we got a quick question here. So Rick,
ahead.
if you can go back one slide there, Jeanette, to the doctor.
The
So,
doctor.
yeah, just saw this here in the notes. So, yep, Rick, they have many doctors. So what you're going to need to do is you're going to need to look up all the doctors. However, you're only going to look up and put in the one that is the PCP, primary care physician. All right, so you have to make sure that you check all the doctors, make sure they're in the network. And if they're not, many states have a PPO option, but you must put in the PCP and select the primary care for whatever client you work with. Does that answer your question there? Great, Rick. Okay, Jeanette, you're up. Sorry about that.
It's okay. Okay, once you go through all the information and review it, then you can hit apply now to submit the application. And it will bring you to a screen like this, where it does give you an option to email the confirmation number, but it also to print the application. When you are enrolling someone, the confirmation number will appear in bold right here, and that's the number you would be giving them. You will print application and save it as a PDF and send it to Dan and myself. Okay. And that's what the Ascend portal is. I do just want to go back. Dan, do you have your Ascend open or no?
I do not.
Okay. I don't know if it's going to be here. Okay, so if you look on this screen up top to the left and you see Deborah's name here, you do want to make sure that your name or email address is always in this corner. If not, you will not get, the app won't be given to you. It'll be just given to WellCare. You won't get
So
credit
great
for that application. Sorry.
segue there. So no worries. So essentially what she's referring to is when you have your own unique login, I'll get to you, Rick, just give me one quick sec here. So there is, when you're in your login and you log into your page, that is unique, that URL is unique to you. Just like your mortgage, just like your bank account, whatever bank you do your banking at, whatever credit card, what have you. And if you remember on all those sites, if you're logged out of it for 15 or 20 minutes, it sends you some sort of notification, and then it's time for you to log back in. It's the same as this in this scenario. If you're logged in and you're working in it, you're fine. If you step away, it'll send you a notification. When that notification comes on, you have to log back in. Otherwise, the next time you put an application into it, you won't get credit for it. As far as a practice screen, there is not a practice screen, but on our Telesales website, you can actually see these exact slides. They're downloaded for you to kind of walk through. These are screenshots of what the actual application looks like. Okay, Jeanette, sorry about that.
That's good. No worries. That's all with this portal.
Okay, excellent,
Fine.
excellent. So, what some of the things that Jeanette touched on, that I touched on. One thing that we kind of use as our key here, and I can see. Okay, slide. I'm gonna take the screen back, Jeanette.
Okay, I just stopped my share.
Can you guys see my screen there?
Yep.
Excellent, great. One of the things that we always ask is for you to make sure that you send us an application to the two of us, Dan at the Div and Jeanette at the Div.com. We will then reply back just to make sure that we've received it. As well, we ask for the, sorry.
This is the old one.
This is the other one, I'm sorry, I thought this one was an update. No worries at all. We're gonna skip step 2 there, go down to actually step 4. We actually ask you to give us any notes that you have taken, whether it be looking up doctors, whether it be looking up drugs, whether it be some sort of history on this person in some way, shape, or form that you've gone through the steps to take. We take it down and we store it on our server. Just in case anything were to happen, come back to us, weeks, months down the road, whatever it may be. We have our story to tell of what occurred with that client. As you said, Rick, some have multiple doctors. Some may have 15, 20 different doctors, and you took the time to look them all up, and maybe you're helping 150, 200 people over the next 8 weeks. You just don't have the best server to save it on. Well, we're going to take that on for you. So we ask you to send everything over upon a sale. Number 5 there, the telephone number. Second thing that we ask for, we want to make sure that whatever phone numbers you did a recording on in the system, we can pull, we can save, and we're not missing anything when the complaint comes through. Essentially, when the complaint comes through, I'm assuming Anthony touched on it yesterday, they basically say to us, all right, we have a CTM or a grievance or whatever it may be. Please send the calls over for XYZ client. We then take those calls, send them right over. And if we're missing some, it doesn't look good on the agent. So we need all the different phone numbers in order to pull the correct calls. And the other one is, in your notes, if you talk to them, let's say you make a presentation to them on October 15th, you do a great presentation, they say, I'm in, but you can't take that enrollment until October 15th. Talk to them on the 1st, on this presentation, and the enrollment's on the 15th. We just need to know those dates so Jeanette knows what to pull from our system and record. All right. Any questions about the after sale process, about the Ascend application? Okay, cool. So, let's see here. All right. I think Anthony's going to touch on a few things before I pass it back over there. I'll touch on our commission side. Essentially, we have our own place where we kind of distribute all our commissions, and we kind of go off a pretty simple piece of rule. When we get paid, you get paid, and we don't actually create a login for you until your very first piece of business gets issued. We'll post it to your site individually from me. I'll email you over your login. Everyone's login is unique to them. It shows just their commissions, and you'll be able to pull it 24/7 whenever you like. All statements get posted on Mondays, but they don't get posted until we actually will get paid, and then you'll have in your account Tuesday or Wednesday at the latest. And are you back with us?
Yeah.
Okay.
So, okay. Sorry guys, I've got multiple presentations here. Okay, can you see that?
Yep.
Okay. So you're going to get, under the current system, okay, and again, remember we talked a little bit yesterday about we're working on some new technology that we're hoping is going to all come together in the next couple of weeks. But for right now, the way we are distributing leads to you is through Google Sheets. You should have some sort of Google account. We're going to send it to you. You're going to open it up, and you're going to find that there is a column that's, I think he even has a colored yellow here, that you can just click on it and click on what the disposition is of that lead. The reason we get so many leads from WellCare is because we really fill them in on the disposition of the leads. It helps it so that leads aren't being redistributed after we've learned certain things. Do not calls and people that are dead. It's pretty crappy if we get them again the next month. So we got to make sure that we disposition these leads accordingly. So if you disposition leads, you get more leads. If you don't disposition leads, you're not getting any more leads. So you got to make sure you stay on top of it. We've made it as simple as possible by you literally just doing there's a drop down there for you to click on, and you pick what you want that disposition to be. There is going to be a section there for you to make notes. That's kind of for yourself. We really don't care about your notes. We care about what the end disposition is. Here are all of the dispositions. Pretty simple, pretty straightforward, but I'm gonna hit them anyway, just to kind of give you an idea. Obviously, if it's in a sale, you enrolled them. Not interested, it's not the final answer. Just because they're not interested doesn't mean that they will never be interested. It means they're not interested at this time. Wrong number. So there's a difference between wrong number and disconnected or not in service. All right. When it is a wrong number, it's a wrong number. The person, you spoke to someone who says there's no one here at that address. Not in service is different, or disconnected is different for a couple reasons. Number one, you want to make sure you dial that number a second time just to make sure. Huge amount of times we have taken leads that are appointment setters. I'm talking about big stacks of leads that our appointment setters have said NIS, 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 and we took them and we gave them to somebody else, and they had an unbelievable connection rate. Now, it's for one of two reasons. Number one, the caller just had fat fingers in their dialing, and it was just a mistake in the way they dialed. Or number two, we are dealing with some lower income people whose phone numbers do get shut off every once in a while and then get put back on. So make sure you do the difference between wrong number and disconnected or NIS. Call for AEP. This is going to make it that the lead's available during AEP. It's important that you, when you're talking to this person, if you find out that their doctor's not in network or right now, or there's no SEP or whatever it might be, that you say to this person, Mrs. Jones, new benefits come out every year. And a lot of times there's changes with it. What I'd like to do is I'd like to review this for you the first week in October and give you a call back then. Does that sound good to you? And then they say yes, and we now have a recorded permission to contact for you to call that person on October 1st, and then code it as call AEP. If you left a message for them, do that. No answer, obviously. I just said disconnect it. Call back. This is the person tells you to call them back in next week, and you're still going to have that lead next week, then do a call back. If a person does not have Medicare's Part A and B, you would make them not qualified, but if they have end-stage renal disease, it's ESRD. Do not call. Make sure you don't miss this one. This is a big deal. You call someone who tells you not to call, and there's a recording that they told you not to call, we kind of have an issue here. So make sure you code those the right way. Doctor not in network, obviously. Deceased, obviously. Language barrier would be someone that anything other than the language that you can understand or you could speak. That's the easy explanation of the dispositions. On the commission side, Dan, I think you just explained the login will be after it's issued. There's certain setups and different things for different people. If you have any questions on this, you could direct them after the call. Communication. So yesterday I went over, you know, the tips from our salespeople that really help a new person get started. One of the things that kept coming up is people being on these conference calls. These conference calls that we have are so valuable, guys. I know I mentioned it yesterday and I don't want to harp on it, but if you could just pull one thing away on a Tuesday night and one thing away on a Thursday night, it's going to make your week so much more productive. They're every Tuesday and Thursday night. They're at 6:30. It's this number that you called into. Tonight, we're going to be focusing in on Pennsylvania and Ohio, a big marketplace for us. I really suggest that you're on that call. The format of that is a little different than what our conference calls normally are. Normally, it's just us talking, you know, kind of, and you guys all participating a lot, you know, asking you, how did your day go and what happened, and, you know, what's one objection you couldn't get over, or something along those lines. So, but tonight is just going to be a little bit different. Your manager, coach, whoever they might be, whether it's Nicole, whether it's Akram, whether it's Jeff, whether it's Dan, whether it's myself, whoever it might be, use the people that we have. The reason we're here is because we want to help you be successful. If you're not successful, nobody's successful. So our goal here is to do everything we can to help you. Use the resources. Have Jeanette help you. Jeanette will help you in any way she could possibly help you. Dominique will help you in any way possible. They're obviously not your secretaries. I got to point that out. Some people like to take advantage of that a little bit, but they're there to help you whenever they could possibly help you. So be sure to use them. WhatsApp. Dan, I do not know how to do the WhatsApp invite, but we utilize WhatsApp for communication amongst all of us. There's multiple groups. There's the Telesales group, and then there's just the Diversified family. That just kind of keeps you in the loop of everything that's happening, including birthdays, but it kind of keeps you in the loop. And then on the Telesales side, it's great to have you throw a question out there right away and somebody answer it, whether it's one of us or whether it's another representative that just throws out the answer because, oh yeah, I've experienced that too. This is what you do here. People post every time there's a sale in there. We really use the heck out of WhatsApp. So we suggest that you download it, and we'll get you an invite to our group chats. And then obviously follow us online for all of our news and updates and whatnot. This we did yesterday, so I could skip that. And this is our client website. This is a website that we've used to try to help generate leads. I suggest that you all go to theroseboys.com and you scroll down to the bottom to the part where there's a little musical instrument note, and it has here the Rose Boys jingle, and then you listen to the jingle. And I'm going to warn you, after you do it, it's going to be stuck in your head for the next week and a half because it's a very, very catchy jingle. You're going to find yourself just walking around singing the Rose Boys at Diversified. I'm telling you, you should check it out. You'll smile, and it'll, like I said, it's a very, very addicting, catchy song. That is everything that we got. I want to suggest that from a contracting perspective, Dan talked a little bit about getting some logins in order to go into the actual. Trying to find it. To set yourself up for the portal and whatnot. Actually, Dan, we don't need to do that anymore, do we? Because of the Ascend app.
Correct. That one was actually updated. I'm not quite sure why it's still on there, but yeah, we did that already, actually.
Okay. All right, great. So now we have to decide, guys, if you are going to be, because I know there's a couple people on the call that are very interested in doing telesales, but not 100% switching over to telesales. We got to decide what route you're going to go, because you can't be a full teledigital agent and a field agent at the same time. So if there's anyone who's looking to be just a teledigital agent, and you need to kind of tell us that, so that we could set you up there. There has been an issue with the contracting system over at WellCare. It is still not fixed. They're telling me they're working on it. So because of it, I am unable to get updated reports right now, which really stinks. But they're working on fixing all of that. So please be in communication with whoever it is you're working with, whoever your manager is or supervisor or point of contact, whatever it is, to say this is the route I want to go, so that we can make sure we get that part all taken care of. I want to open up the floor for any questions you might have.
Yeah, Anthony, is there ever an instance where leads are given to multiple agents, same leads?
There should not be. First of all, within our organization, absolutely not. Now, what will happen is WellCare has these PDP leads that every month they're being re-scrubbed, and then they are being given back out. So there is a chance that when you get a WellCare PDP lead, it has an expiration date on it. All right, they are not yours to work indefinitely. You have in the WellCare system permission to work that lead, and then they yank them all back at the end of the month from us. So we are not allowed to call those leads after that. So it may be given to another person after it's not in your possession, but you got to be careful not to continue to call those leads. I say they get yanked back every month. They expire on the last day of the month. However, for open enrollment, we are going to have them for all of open enrollment. So once we get these leads on October 1st, they are going to be ours through the remainder of the year. So that's a big deal. But the only way that other people will be working the same lead would be if they're not supposed to be working that lead.
Okay. And you mentioned earlier that agents are sometimes making anywhere from 50 to 100 calls a day. I guess I'm getting confused or hung up here. What's the difference between having an appointment set for you and making outgoing calls? Is there a difference there?
So you want to focus in on this as if you're going to be making a bunch of outbound phone calls. In the meantime, what we are going to do is we are going to have our appointment setters work to book you some appointments for a specific time as well. So you want to look at it as if I'm going to make 100 phone calls tomorrow, and all of a sudden you get 3 emails tonight that says, we got you at 1 o'clock, 3 o'clock, and 5 o'clock for you to call. That was a person that we called, spoke to them very, very little, but basically said, Mrs. Jones, we'd normally send somebody to your home, but due to the current circumstances, we're actually going to be doing a phone appointment for you. And we book a 1 o'clock appointment, and the specialist is going to be giving you a call at that time. That's one way of there being an appointment. Another way of there being an appointment is we're actually calling some people and speaking to them and saying flat out, you know, I don't have a specialist available for you right now, but I probably will in the next 30 minutes, and he's going to give you a call back. That's another way that we're trying to do things. So we're trying our best to keep you busy. But I want you to focus in as if you're going to make a bunch of calls, and then let us fill your coffers with phone appointments as well. That make sense?
Yeah, so it's really a threefold approach of, so first and foremost, the agent should go under the presumption that there will be no leads, not leads. There will be no appointments booked for him, and be happily surprised when there are some that come up.
Correct. And that happily surprise should be every day.
Okay.
That's the intention. That's the intention.
Got it.
You know, TJ, it works a little differently based on, quite honestly, based on the setup of the person we have. And, you know, you would be a person that would be getting appointments. You know, someone who owns an agency is not going to get appointments.
Got it.
You know, they're managing too much. You know, there's all different ways to
Okay. All right. Thank you.
You got it. Any other questions?
Yeah, I guess one more here for me again.
Sure.
What's the best, am I just, straight up diving in, right? What's the best way to practice from start to finish aside from just falling on my face?
Role playing.
Okay.
Role playing, without a doubt, role playing. It works, man. It really works. you should sit down and role play with Seth. That's what you should do. It absolutely is the best way. In the meantime, we got to figure out where the heck you stand on a contracting perspective, and I don't mean that as
Yeah, I'm pretty sure I'm good.
okay. Okay. I won't say you are not, because I can't trust reports right now.
Okay.
So I can't say you are not, but we'll find that out. We'll find
Okay.
that out.
All right, cool. And then, hey, one last thing. Again, I swear this is actually the last thing.
No, you're absolutely fine, man.
That call from last night, I was not able to make that. Is that going to be reviewed tonight, or is this in addition to last night? Is there a replay from last night?
This is in addition to.
Okay.
Now, I'm not sure. And do we have? Where did we put all the recordings? Dan, it's sent. It's the div.com/centene.
I'm sorry, one more time. The recordings, the Greg and the Heidi recordings?
No, the train. I'm sorry. Give me 1 second.
If you're referring to like all of our stuff, like these videos of exactly what we just went through and everything today, it's the div.com/telesales.
No, not the telesales. The it's the div.com/centene. That's where we had the West Coast as one recording, and the Midwest and the Southeast. However, the South.
Oh yeah, that's
Central,
17. Yes, you're right.
the
That's
South
10.
Central, which we did last night, we did not post yet. Oh no, wait. No, here it is. It's up there, man. They're calling it the Southwest, but it's actually called the South Central. It is up there. If you go to the div.com/centene and scroll down to the bottom of the videos, it's the lower right-hand corner video. It says Southwest West region. So that was last night's, and then tonight's will be Ohio and Pennsylvania.
Okay. All right, great. Thanks.
All right. And actually, Dan, something you just said about the div.com/telesales, it looks like the Ascend tutorial is actually under the Centene page. And that is actually just a telesales tutorial, not a full Ascend tutorial. So you and I will talk about that. I'll talk about it offline. All right, what other questions do we have? Nothing? Jacob, give us a thumbs up if you're good. Dave Chittenden, you good? There's Dave's thumbs up. Okay, TJ's good. All right, guys, with that, then we are going to wrap it there for today if nobody has any questions. Dan, Akram, Jeff, Nicole, anything?
Good.
Looking forward to working with all of you guys. Great job last
Rick
couple
is
days.
good. Everyone's good.
Awesome. Awesome, guys. Thank you. You guys have a great day, and hopefully we'll be talking to you in about 2 hours.
Thanks, guys.
All right, everyone.
Talk to y'all later. Bye-bye now.
Bye.